Assalamu alaikum wa rahmatullah. I am Dr. Ahmed D. Abdulwahab. I am a diagnostic radiologist working in Erbil, Iraq. Today we will continue with our cases for discussion. Today we have a nice case of a 21 years old male patient presented with long-standing, since birth, convulsions for brain MRI. I have no idea if he had an MRI before or a CT scan, so it was brain MRI with contrast according to the request of his referring neurologist. And these are the images that we have done. First of all, you need to know this is a T2 weighted axial images of the brain, and as we said before, you can know that because the CSF here is bright and the eye globes are bright, so a fluid bright indicates a T2 weighted image. And here we will, of course, today I will not give you any answers, just presenting to you the findings. You can see that there is no midline shift, and you can see no signs of edema, cytotoxic, or vasogenic. So this is the T1 weighted image, and as we said, you can know this is a T1 just by looking at the CSF, and the CSF here is dark, indicating a T1 weighted image. And again, you can see that there is no midline shift and no signs of bony destruction, for example, or anything else. Now we will see the coronal flare images, and flare are basically T2 weighted image without the CSF signal. You can see the CSF is dark, and since the gray matter is brighter than the white matter, so this indicates a T2 weighted image with no CSF, which means flare. So first of all, we will see what's going on here. Let's see this. We have also the sagittal T2 weighted images, and we see that there is nothing remarkable on the sagittal images. Of course there is something, but I will not tell you now. Let's see the post-contrast images, post-contrast T1 weighted axial images, and I'm trying to show you the abnormality. I wonder if you find it or not till now. What is the abnormality and what does it mean and where it's located? I'm just trying to show you, and I will not give you any hints today. If you want to know, then you have to wait till tomorrow for the answer and the explanation. And this is also coronal T1 weighted post-contrast images. You can see it here. Okay, you can see it here, the abnormality. And well, let's go back to the most obvious images. That's the T2, the axial images. It's very obvious here. The abnormality is very well shown in this cut in particular. So what do you think? Write me your description and your diagnosis in the comment section, and I will reply to you as soon as I can. Thank you very much for your time, and I hope to meet you again tomorrow. Thank you.